Hello. So for this week's journal assignment, I decided to use this one that I recently had a patient encounter with. It is a 15-year-old male. He has a diagnosis of ADHD and conduct disorder. One of the biggest things that stood out to me with this particular case was the patient's mother. She was present for most of his visits. This is what the nurse practitioner that I am doing my clinicals with stated that his mother is always present during the visitation, and sometimes they're in person and sometimes they are virtual. This particular young man has very bad issues at school. He's had to go from school to school because a lot of the schools have even expelled him because of his behaviors. He doesn't listen to anybody at all, and he doesn't pay attention. The mother in this particular case does not want her child to take any medication. It has been offered, but of course, it's her right to deny any type of medication treatment. But to me, the part that made it sad is because he's continuing to go from school to school, and there are family members that doesn't want to be around him. They don't even have. There's a lot of family members that don't even let them come to their house because of his behavior. So, what stood out to me the most was, and the significance of this PMHP role is to, of course, encourage what they feel is needed, but you have to respect the boundaries of the patient and the parents. And he's an adolescent, so in this case, the parents are the ones who have the right to make that decision. And they don't want him to take any medication. They don't feel like it's going to help. They feel like that it's going to make it worse, and they feel like it's going to put a label on him, in which the diagnosis is already there. So the label, in my eyes, is already there because it is the truth. But I just feel that, in my personal opinion, why this was challenging to me and where I see my limitations was, it upsetted me to see a parent don't not want their child to get the best treatment or the best help that they can get so that they can grow into be like great adults. So it's like what starts at a young age goes into adulthood if it isn't treated, or if the right forms of treatment isn't delivered to that child. So strength wise, I would say being able to actually put on a poker face and, you know, act as if I understand everything that she's saying during the meeting. And that's your right if you don't want him to be on anything. And that's what the nurse practitioner kept saying. It's your right. I understand. He doesn't have to be on any medication, but exactly what has been going on with him. So she continues to remind the mother of the behaviors of the child, but it doesn't change the fact that she doesn't want him to be on any medication. Of course, there are other forms of treatment as well that he's been offered. Psychotherapy. He refuses to go there as well. So it's almost like you want to continue to see a nurse practitioner to let them know what's going on, but you're not following up with any other recommendations. So I just found this to be a very difficult, um, I would say, meeting because I work with children at my hospital that I'm at now. I used to anyway. They're gone now. They're across the street. But when I did work with them, I didn't see too many cases like that. Most of the parents were more trying to figure out why, no matter how much medicine or how much therapy, why their child still is needing help, or why things aren't helping and what more can they do, versus not wanting to help them at all. So I mean, of course, I do understand that patients have their right, but it just was difficult for me. So I would say my strength is being able to keep that poker face, and the limitation is just how it personally made me feel. But of course, there's nothing I can do about it as a student or when I finish school. That's just something that we have to learn to understand is going to happen. um to reflect on the specific learning and insight. I'm just being professional, remaining professional and understanding. And that's exactly what the nurse practitioner does. She does great. I think she's wonderful. She does great. Even though like I said, my limitation is feeling like, oh my God, like I can't believe that she really doesn't want any help for her son. And she's continuing to name more. Like during the meeting, she's like, we went to my mom's house. My mom said he can't come in. I'm like, okay, so nobody wants to deal with this child, even not the teachers, not the parents, I'm sorry, not the parents, the family members, the grandparents. And most of the time, a lot of times grandparents will continue to try with kids no matter, how hard it is. Even the grandparents that gave up on him. So it's like, you're not going to do nothing to try to help him. So that was it was kind of rough for me to see. And then when it was over, the nurse practitioner did go into depth about how long she's been seeing this patient, and that made it even worse. I'm like, you're continuing to see him over and over with the same exact results during every visit. So I guess he has to actually really do something serious to be maybe admitted into a psych hospital or something, or residential program or something. But even then, from what I've seen when I worked in that field with the kids, when they used to be at my building, the parents still had the right to say no. So, and a lot of the times, I did have one particular young man. I remember his mom didn't want him to take anything. He had it was it was a psychotic episode due to substance abuse. And the parent didn't want him to take anything. And the psychiatrist discharged him because it's like, if there's nothing I can do for you, what's the point? So, yeah, but it touched my heart because I love kids so much. And to see them and know that there's help out there, but the parents aren't doing all they can to help them, just, kind of hurt my feelings a little bit to see that. But like I said, I just had to put on my poker face and be professional, just like the nurse practitioner was. And that's about it. Thank you.